Okay, we are mid-May. Gosh, years are going fast. Time is going fast here. We have a famous engineer from the St. Louis area, correct?
Correct.
And I was just discussing the reaction of other ophthalmologists to what I do. But why don't you tell us about your first, did we get the floater that was bothering you?
Yes,
Yeah.
absolutely.
And my impression, of course, was that it was not as dense as a lot of things I see, but it was fairly posterior, so it appears a little larger to you as a film or a blur that moved across your vision. And in your line of work, you're looking at detailed stuff, correct?
Correct.
So it's annoying. And,
Right.
if you were out there, maybe in agriculture or something else, or fixing air conditioners, that might not bother you so much. But for you, it was a problem. And you believe this is a significant improvement, correct?
Absolutely. Very
And I always tell patients, although I think I'm very skilled at this, there are some things that just can't be gotten. You had some minimal stuff in the right eye. You asked me to look at it, and I gave you a straight answer that
right.
I didn't think it could be done. In any event, we discussed your ophthalmologist up in St. Louis, and you related that he had seen a video, probably from one of the companies out there that is maybe promoting their other laser. Which I don't use that laser, but I have tried it and find it to be useful. Uh, but your ophthalmologist didn't give it any credibility.
He didn't promote it. He didn't suggest I seek it. He just virtually said in the beginning that there was nothing that could be done, and I had to learn to live with it. And I decided that I was not going to live with it forever, and then that's why I started doing my research on finding laser surgery.
Well, he did actually say that he could refer you to a retinal specialist, but the retinal specialists, as we know, in virtually all cases say live with it, which is the standard party line, or have a vitrectomy. And not that I'm against vitrectomy in certain instances. Vitrectomy is a good operation, but when you're over 40, you're almost guaranteed, almost I say, maybe not 100%, but I'd say well over 90, cataract, and that requires another operation probably within a year. So it's not the easiest thing to undergo. A laser, in my opinion, is always the procedure of first choice if the opacities can be done with laser. So you're happy with it?
Absolutely.
If you're happy, that's what keeps us going, a happy patient. Thank you.
Thank you.